How is a neck lift procedure done? First of all, I want to describe what a neck lift is and why people want it. People don't like their neck skin as it sags. It could be their skin, it could be fat, it could be the fact that their muscle is banded and they've got some lines here from the contraction of their platysma muscle. It could be any of those things. Now for me, I rarely do a neck lift alone. Lift up this part of the skin without lifting the midface and the jawline. That I call a lower 2/3 facelift. Cheek, jowl, and neck lift. I rarely do the neck alone, and here's why. Because if the woman is 50 or 55 years old that I'm about to operate on, and if I pull this very tight, they notice their jowls and the sagginess around here, and this is better done more evenly as a unit. There are occasions that I will see a male who has a lot of hanging of skin here, and they don't really care anything about what this part of their face looks like. So I may do a neck lift on them, but it almost, in order to redrape all of that, I almost have to make as long an incision as I would for the entire facelift. Because realize, the more redundant the skin is here, the longer the incision has to be to equalize it after everything gets pulled up when we do the job. So for me, I uncommonly, not never, but uncommonly do a neck lift alone. How long does it take to recover from a neck lift? A neck lift alone takes a little less time to recover than does a full facelift, full lower facelift, but it takes almost as much time. The way I do a neck lift is to make an incision behind the ear into the sulcus between the ear and the head, and it usually has to come a little bit in front of the ear. If that's in a woman, the incision goes behind the tragus. If it's in a man, it's in front of the tragus, because we're moving the beard back, we're moving all this tissue back, and in a man, we would be moving their beard back. We don't want to make an incision back here and have them shave inside their ear. But I use as long an incision as I need to redrape after all of the deep stuff is pulled up. After it's all pulled up, we cut off the redundant skin and we make everything match, the matchy-matchy thing, and we make it match up perfectly. I like to not move the hairline in any way, and that's really what it takes. I wrap patients up after that for a few days. They're in a wrap. I do not use any drains. Many doctors do use drains. It's not wrong to use a drain, but I like the fact that all of my patients, neck lift alone or face and neck lift, don't need a drain. The procedure for me takes about an hour and 45 minutes to do complete face and neck lift, no eyelid surgery. That's how long it takes. And I can do this under sedation anesthesia or general anesthesia. If you have questions about your neck or your face, it's aging not in the way you like it, and you want to rejuvenate and refresh your face without making it look operated upon, I would love to talk to you. I would love to see you in my office. I see people like you every day, and I do many facelifts each week. Call me. Thanks.